Can you take prednisone intermittently, just 3 to 4 days a week, every week? Is that a thing? I got this question recently and I wanted to answer it. This person says, I have COPD. The magical dose for me is 15 milligrams. If I took 15 milligrams 3 or 4 days a week only, would I benefit by diminishing the overall intake? Thank you for your amazing work, Dr. Megan. I wish you the best. So let's talk about this. Let's talk about the science, some options, and what I would do. So it's a good strategy to be trying to figure out ways to minimize your exposure to prednisone. This is one possible way, just taking it 3 to 4 days a week, but there are other ways. So let's discuss what those are. And I completely understand how managing a disease like COPD or asthma can be very challenging, trying to find where is the best balance of benefits and risks. Inhalers, nebulizers, prednisone pills, or what? So in COPD, prednisone is suppressing inflammation that can help manage your symptoms that could be shortness of breath, flare-ups, just difficulty breathing in general. But you probably know this, that prednisone is affecting the entire body, not just the lungs. So the side effects are going everywhere. That leads to increased risk for up to 150 different side effects. Here's a picture of what I personally experienced. And the long-term use increases your risk for bone loss that can go to osteoporosis, heart disease, diabetes, eye complications, and the list goes on and on. Now, it is true that the number of grams of prednisone over a lifetime is a predictor of these complications. If you've been on 5 grams of prednisone or more, you're at an increased risk for heart disease, diabetes, and osteoporosis. And so minimizing your number of milligrams or grams over time makes sense. And I'm not sure how you meant the 3 to 4 days per week, whether that was, for example, Monday, Tuesday, Wednesday, maybe Thursday, or if you meant Monday, Wednesday, Friday, Sunday, and then Tuesday, Thursday, Saturday, just basically every other day. I'm not sure which strategy you were talking about. Well, let's talk about the first one where it's like a block of 3 to 4 days where you take it, and then you're going to have another block of 3 to 4 days where you don't take it. So your body's going to be up here for a few days, and then it's going to be down to nothing for a few days. Then there's the other, which would be up, down, every other day. So this block strategy I have never heard of before. I don't know any research about it, but in general, at a dose high enough to be 15 milligrams, your magic dose, you're suppressing your adrenal system, your HPA axis. And 3 days of a break isn't necessarily enough to recover it. So then let's talk about the every other day dosing. This is actually an option that is outlined in the FDA approved drug package insert that is available at the pharmacy. And in that situation, they have an official name for it, ADT, alternate day therapy. And in this situation, you'd take your magic number every other day. So you do 15, 0, 15, 0, 15, 0 every day perpetually. Or you could take double your magic number if that's not getting to your happy point. So that would be 30, 0, 30, 0, 30, 0. But I would definitely start out at the lower number if it were me. So in that case, that was FDA approved. And they go through all of these rationales and theories in the package insert. It's the weirdest thing. Like, they don't actually go through studies proving this. They're just like, here's the rationale behind it. I've never seen that in another package insert. Other package inserts are like straight up facts. This one is outlining all of the possible ways this might help. And it's possible that it might, but they didn't actually study it that I'm aware of. I'm really surprised that it made it into a package insert, frankly. Like, stunning to me. I don't talk to many people whose doctors prescribe it this way, because those who do, who have talked to me and are like, I'm on this alternate day therapy, have talked about how awful it is. That on the on days, they feel good. On the off days, they feel horrible. And that has been the general feeling I've gotten from everyone, instead of this theoretical, hey, it might help your HPA axis recovery. And then, so we're talking like, there's 3 factors to consider here. There's your disease control, there's your HPA axis recovery, and then there's the side effects, right? Like there's 3 factors to consider. Let's talk about the first, your disease control. Taking prednisone every other day may or may not be enough to keep your disease under control. It's really dependent on you, your level of inflammation, the progression of your disease. It may or may not be. So for a lot of the people I've ever talked to, it's simply not enough to give them the relief that second day on the off day. So in that situation, maybe it's not a good idea, but maybe it is. Like it's an experiment you can try. Second, your HPA axis recovery. So back to your brain, communicating to this place right above your kidneys to give you the stress hormone natural release cortisol that prednisone is mimicking, that adrenal hormone that can save you from stressful disaster situations like getting in a car accident, having surgery, things like that. It may not be quite enough time to recover that. I don't think they did any research to prove this. So it's just like, hey, it might be enough to help the adrenal system recover. Like their original purpose is maybe there's less damage or less like adrenal complications if we do this alternate day therapy, but they didn't actually prove it that I'm aware of. And then finally, side effects. So you're still getting 15 milligram exposure every other day, which adds up over time. But on those off days, maybe that night you'll be able to sleep better. Maybe you don't have as many hunger cravings. It's really an experiment worth doing, but the overall exposure over time is going to increase your risk for heart complications, bone complications, metabolic complications like diabetes. So it's definitely worth discussing with your doctor to see if it's right for you. That maybe this is the best balance of risk and benefit in your situation. And if you want to be recovering your adrenal system, generally, it's by getting on whatever is the lowest effective dose for you. It sounds like in your situation, that right now is 15 milligrams. Getting there and then slowly tapering off over time. Instead of going full blast 15 milligrams every day and then 0 for a few days and then back, down, up, down, up, down. It might be more steady and potentially get you into a safer place long term. If you were to start out at 15, hold that until you're feeling stable, and then drop a certain amount, whether that's 1 milligram only down to 14, or whether that's 2.5 milligrams down to 12.5 milligrams. But then you hold that while your disease stays stable, and then you get to another drop, whether that's from 12.5 down to 11, or 12.5 down to 10, but then you just hold that for a while, keeping a slow and steady taper. And those drops could be anywhere from a week to a month or even longer. And you could even do alternate day dosing of that, going from 15 and then switching off 15 to 14, 15, 14, 15, 14, if you need a really gentle taper. I have lots of awesome taper strategies in my free printable PDF taper chart. You can just click the link below to download it now. Those are just some of the options that are in there, and you just print it off and find out where your dose is and then follow it to get you slowly off, whether it's over a few weeks, a few months, or even up to a few years. Finding the taper strategy that works for you is important. Working closely with your doctor to get the right doses of prednisone prescribed, because the only way to get to 14 milligrams is with a 10 and 1 milligrams, right? Like your doctor has to prescribe that. So working closely, listening to your body, your symptoms, making sure they stay under control. Finally, doing everything you can to need as little prednisone as possible. What I'm talking about here is with COPD or asthma and other breathing diseases that require prednisone is optimizing your use of inhalers, steroid inhalers, and others that are recommended in the guidelines by the doctors. Maximizing your use of non-pill therapies is a good strategy. Inhalers, nebulizers, all of those things Getting those to the best level is really important. In addition, maybe you're not actually using your inhaler right. This is something in pharmacy school they taught us to always verify inhaler technique, to have you as the patient show me as the pharmacist how you're doing it. You'd be surprised how many people have been on inhalers for years and years and are doing it wrong for whatever reason, or could be doing it a little bit better. So make sure that you show your doctor or your pharmacist how you're actually using it, to make sure that you're optimizing what drug is actually going into your body via inhaler technique. And finally, if you're like, all right, 15 milligrams every other day, that's what I'm doing. This is my plan. I'm going to stick to it. Great. Own it. But at this point, you need to be doing everything in your power to minimize the complications long term. For example, back to the bone loss, the possibility of osteoporosis and broken bones. You need to be following the guidelines by the doctors who prescribe prednisone when they recommend that you need to be optimizing calcium and vitamin D. You need to be getting exercise. You need to be cutting out alcohol and smoking, doing all of the things you possibly can to protect your bones. You need to protect your muscles, your metabolism, all of these things. And that is why I recommend getting on Nutrinized Zone. It is invented specifically for people on prednisone. There's 2 in the morning and 2 at bedtime to give back those nutrients that prednisone steals, leading to the bone loss, leading to the complications, the side effects. And when you take this alongside your prednisone with optimal inhaler technique and therapy, this is going to be your best balance, because you've already decided I'm going to be on that prednisone. We'll take this alongside it. And then you can feel confident that you're doing everything you can to minimize your bone loss, to minimize complications going forward. And it's not just bone loss. It also helps with your metabolism, keeping a healthy weight, and your sleep, getting restful sleep at night so that your body can get as much healing as possible. You can get this at Nutrinized.com or on Amazon. Signing off as Dr. Megan, your prednisone pharmacist.